So I've been in practice now almost 44 years, and I am a board certified gynecologist. I don't do gynecology anymore, but when I did, I actually subspecialized in urogynecology. And I was more of a pelvic reconstructive surgeon, which meant most of my patients were women who were menopausal or perimenopausal. And for this reason, I used to prescribe a lot of hormones. But unfortunately, I prescribe commercially made synthetic hormones because that's what my medical societies recommend. However, I had concerns because I used to see at least one case of breast cancer per month, and I felt it was related to the synthetic hormones. So I started studying about plant-based hormones and studied the science. And by looking at the science, I was able to validate their efficacy and safety and realized they were completely different molecules from the synthetic. So I switched all my patients, including my wife, who was menopausal at the time, from the synthetic to the plant-based hormones, and women had extraordinary clinical changes: better energy, better vitality, better sleep. And study after study shows that when your levels are good, not only do you feel well, there's a reduction of age-related diseases, a lower risk for heart disease, a lower risk for breast cancer, a lower risk for dementia. Then about 8 or 9 months later, I'm starting to get phone calls from the husbands or male partners of my female patients saying, "Hey, can you treat me? Because my wife or my partner is doing really well." And as a courtesy, I started treating the men. They did well. And sure enough, 3 years later, my practice goes from all women to just about 50-50 men and women. I personally have been on these hormones since I was 49. I'm 73 years of age. When I got on them, I was struggling. Worked out every day, I ate clean, tired, gaining weight, aches and pains, checked my levels and discovered several deficiencies, put myself on a hormone protocol, and within weeks I was a new person. 3 months later, my body fat went from 28% to 12%, my waist size dropped from 36 inches to 31 inches. I even used to take a statin drug for cholesterol. That dropped 100 points. I was able to get off of it. So even though I'm 73, I'm very passionate about these hormones. I see over 40 new patients per month. I became a doctor to help people. So it's so gratifying to have people do well, but not only do well, but live longer. That's why I continue to practice and promote plant-based hormones.